So, in a patient with classical rheumatic mitral stenosis, the first heard sound S1 is loud primarily because of the which mechanism. So, first you'll understand the theory. Now, for example, if this is a left atrium, and normally if the pressure is 5 here, this is your mitral wall, and the left ventricle pressure is 4 here. So during diastole, the pressure difference is not much. The pressure gradient, the book says that pressure gradient between left atrium and the left ventricle during diastole is not much. So the blood comes from the left atrium to the left ventricle, and when the left ventricle start contracting, as soon as the pressure of the left ventricle increases slightly to that of the left atrium, the mitral valve closed down. So normally the mitral valve closed down and it produces a very soft sound. So the S1 is soft. Here in this case, if the left ventricle pressure will be more than 5 during the contraction, then the mitral valve will close down and it will be a soft. Now, for example, if this is your mitral valve which has been stenotic, then the area here will be less. Now the left atrium will have has to pump against a high pressure system. So now the mitral valve will be open for a longer period of time because more blood has to be pumped through a small area. Now, if the pressure in the left atrium now is 25, the pressure at which this mitral valve will be closed down during the left ventricle contraction has to be 26. If we say this as an example, so now the pressure of the left ventricle has to be more than 25 for this mitral valve to close down. Okay, so now which was earlier was 5. Now, so if you see from 5 it has become 25. Now the mitral valve is closing at an increased pressure of the left ventricle. So this produces a sound which is loud because it is just like you are closing a door with a very high force, with a high pressure. So now if you see, if anybody asks you why there is a loud S1 in the mitral valve, it is because the pressure of the left ventricle at which it is closing down has increased. Please remember, there is not increase in the contractility of the left ventricle or the rate of change of the pressure in the left ventricle. Please remember this. Now, we have to understand a very important point here. If we have an hyperdynamic state, for example, in anemia, beriberi, thyrotoxicosis, and in fever, here the mitral valve is not closing at an increased left ventricle pressure. It is closing at an increase because of increased contractility or increased rate of change of the pressure in the left ventricle. So this is the difference between an hyperdynamic state. In an hyperdynamic state, the closure of mitral valve is because of the increased left ventricle contractility, or we can say increase dp by dt, or increase in the rate of change of the pressure in the left ventricle, not because the mitral valve is getting closed at an increased absolute pressure, which was seen in cases of the mitral